Hi everyone, it's Jana here. And as you know, I promised we would get Angela to come on and have a chat with us about the important aspects of GLP-1s and why she's so passionate in the weight management space.
Hello, hi Yana. Thank you so much for having me on your channel and hello everyone. So my name's Dr. Angela Kwong and I'm a GP practicing in Sydney and I'm so excited to talk to everyone all about GLP-1s. So I guess one of the reasons why I got drawn into this space was because I had so many patients asking me for help with weight management. And in my program, about 1/3 of the patients that I look after are patients who are going through perimenopause. And I don't know if you know this, but women going through perimenopause typically have never really struggled with their weight before up until this point. And they say, I've never struggled with my weight before. All the things that I used to do don't seem to work anymore, whether it's hitting the gym, whether it's cutting down their calories, whether it's reducing their carbs. They try all of these things that used to work. And yet, what they seem to notice is that their waistline is growing. Even their breast is growing, and they don't seem to appreciate that at this part of their life. And they say, I have trouble zipping up my pants, I have trouble doing up my bra, and they don't appreciate the shape changes that happen. This is something that seems to be invisible to them, even though they can feel the hot flushes, they can struggle with the anxiety changes, they can struggle with the sleep changes. They really wonder what's going on inside. And as I've said at many conferences, at many webinars, your body goes through a lot of metabolic changes. Your body's going through a lot of hormonal changes. As your estrogen levels are starting to dip, for many women, you're actually going through a period of rapid insulin resistance. And, back in the day, we used to think about diabetes as a yes or no condition. When you are officially out of range on your fasting blood test, we would label you as someone who had diabetes and you would start getting treated so that we would prevent you from having diabetes with complications. But now we're starting to think about it a bit earlier. Now we're starting to pick up on pre-diabetes and insulin resistant and pre-insulin resistant states like polycystic ovarian syndrome or gestational diabetes. So that's what I want my women with perimenopausal symptoms to think about, in that we're going through a period of rapid insulin resistance and we need to be thinking about strategies that we can do to gain control of their weight.
And so, where do GLP-1s come into this, or different types of nutritional plans? What do you recommend when you speak to your patients?
Yeah, so there's lots of different strategies that we can use to help patients with perimenopause, and they can kind of fall into lifestyle interventions and medical interventions. Lifestyle interventions might be things like strength training, it might be in reducing your carbohydrates and increasing the complexity of the carbohydrates that you're doing. When we talk about things like our GLP-1s, for example, these were originally designed to treat diabetes. And I know that there's a little bit of stigma in the community in that they should be only reserved for diabetes. But like I said, diabetes is on a spectrum of insulin resistance. And that's the reason why it tends to work for pre-insulin resistant states as well. I've also had many patients who have been pre-diabetic, who have been insulin resistant, who have polycystic ovarian syndrome, who don't necessarily have established diabetes, and yet they do have very good results with improving their weight. And that in itself improves their metabolic health and helps them to reduce the risk of chronic disease.
And so, in the weight loss section, as you know, I came to you because I use intermittent fasting and I did use a GLP-1 to kickstart that journey. My BMI, it's hard to say this, Angela, but was 28 at the time, which, as an Olympic athlete and someone who's worked in medicine for so many years, embarrasses me a little bit. But, there's many of us in that case, where we have put on a little bit more weight. And, some people would love to have a BMI of 28. So I went to my endocrinologist at the time because I also had a HbA1c at the time of 6.7. So I was in two categories. I was a little bit overweight, but I was also in that diabetic situation where I had to make a change. And I was recommended to start a GLP-1 alongside with a new nutrition plan. Can you talk us through what women are coming to you and where your recommendations sit and also a little bit around what the different GLP-1s are? Because obviously some are directly for weight loss and some are still in recommended for diabetes.
Yeah, the first thing that I want to address is the topic of the BMI, because the first thing is that a lot of people will get discounted and think that, okay, my BMI is only 28 or my BMI is not yet above 30. But as I've been teaching a lot of GPs at my educational webinars, the BMI is not the be all and end all. We've actually got to treat human beings and we've actually got to treat people. People are a gamut of their entire levels of risk. And you might be a person who has a BMI of 21 and you're fit, you're healthy, you're lean, you're doing really well. But you might also be a person who has a BMI of 28, you already have pre-diabetes, liver dysfunction, obstructive sleep apnea, and you're on the road to metabolic dysfunction and chronic disease. These are two very different patients with a BMI of 28, and they don't necessarily have to be treated the exact same way. So I tell my GPs, I tell my patients that I don't judge you based on your BMI. I look at you as a whole person based on your blood results, based on your past medical history, based on your family history, and based on what your health risks are going forward. Because at the end of the day, what we really want to do is have people in really good health. We don't just want people to have the best numbers on the scale or the best BMI just to make the numbers look good.
Can you tell us a little bit now about what the actual medications do? So what are GLP-1s?
Yeah, so GLP-1s are medications that were originally designed for diabetes and they work at a couple of different levels. The first level that they work at is at the level of the brain. And at the brain, they do a couple of things. Number one, of course, they reduce your appetite. And some people think, okay, that's fantastic. They're an appetite suppressant. They don't just do that. And you don't just have to take the medications to suppress your appetite. They do a bunch of other things. They also reduce your food noise. And for a lot of patients, they say to me, this is amazing. For the very first time, I don't have to constantly think about where my next meal is coming from. I don't have to think about, planning my shopping list or planning the dinner. I can actually have reprieve and I can actually think about planning good meals. I can actually think about how much protein content that I need to have rather than scoffing down all of these snacks. So for a lot of people, the reduced food noise is the best experience that they have on the GLP-1s. Not that I'm necessarily promoting GLP-1s, but for a lot of my patients, that is the very first thing that they notice and the biggest positive that they experience. As we go down, the next thing that it does is it works at the level of the stomach and it causes the stomach to work in slow motion and it slows down your digestion. And what we notice is when it does that, it also delays your gastric emptying. So what that means is that food empties out of your stomach slower. However, some people do also notice a bit of reflux, nausea, and bloating when that happens. At the level of the pancreas, it increases your insulin excretion. So that means that you're going to have more effective glucose lowering, and that's how it works as a diabetes medication as well. And for those patients who are insulin resistant, that is how it helps with reducing your glucose levels. Then down, lower in the gut, it also helps with slowing down your digestion. So you do have a longer feeling of fullness as well. So you can see that for some people, they think that these magical medications, the GLP-1s, I'm just taking them to suppress my appetite. So more is better because then I'll have no appetite and then I won't eat. Not necessarily. They are working at multiple levels throughout the body to help you to process your sugars, to reduce your food noise, to slow down your digestion, and more is not necessarily better. The way that I like to prescribe GLP-1s is the right dose for the right patient at the right time. And also for a lot of my patients, I think about what are the factors contributing to their weight. So what's the reason why they had trouble with their weight gain in the beginning? Were they insulin resistant when they were going through perimenopause? Did they have pre-diabetes? Did they have a problem with their thyroid? Because if that's the case, we don't just want to be giving them a GLP-1, we also want to be treating the underlying problem. And if we can do that, it means that they may not necessarily have to be on a GLP-1 in the long term.
And actually, that's a great leading question. So can you take GLP-1s short term just to kickstart yourself into a good nutrition plan, or have you found it more effective for someone to be on them more longer term?
This is my personal experience, although it might not reflect all GPs. In my personal experience, about 80% of my patients don't use it long term, and about 20% of my patients use it in the longer term. And the reason for that is it's got to do with the way that you do the initial assessment. It's got to do with the way that you are figuring out the patient's factors contributing to their weight. You know, what exactly has caused this patient to have difficulty with their weight leading up to this point? Have they got a very difficult relationship with food? Have they got a lot of food noise? Have they got a lot of nutritional deficiencies? Have they actually got very poorly controlled autoimmune disease? Have they got untreated hypothyroidism? There are so many people who have medical problems that have not quite been optimized, or issues with their relationship with food that have been unaddressed. And when you can actually address those problems, in addition to kickstarting for a short period with your GLP-1s, those two things combined are so powerful, and not everyone needs to take a GLP-1 for the long term. So for the great majority of my patients, we use it for an interval, which is to kickstart the patient while we are addressing their underlying root cause, and at the same time getting them into a really good routine and optimizing their lifestyle factors.
Now, that was certainly my experience, was to sort of kickstart my journey into intermittent fasting. Do you have any information around the sort of the intermittent fasting or nutritional plan that you would like to share with our group?
Yeah, intermittent fasting suits certain people, but not everyone. For some patients, they absolutely love intermittent fasting, and it goes very well with GLP-1s because, like I said, it's the very first time that they've had reduced food noise. So it's also the very first time that they've been able to have reprieve and also be able to consciously make decisions. So, I am going to pass my breakfast, I'm going to pass my lunch, and then I'm going to make a very deliberate choice about what I choose for my next meal. I'm going to make a very deliberate choice about what I'm going to have for my dinner. I'm going to make sure that I'm very well hydrated, and all of the deliberate choices that you're making are balanced. They're good for you. You're maintaining your hydration and you're really in control. And it's very different to how it's been before this, where it's kind of been haphazard and you have any old thing as fast as you can in order to be able to get through the day and to maintain your energy levels. So for a lot of people, intermittent fasting is absolute gold for them when they've combined that with the quietened brain that they have achieved with GLP-1s. For other people, they can run into a little bit of trouble with intermittent fasting with GLP-1s only because they get too many nutritional gaps. So if you have been taking GLP-1s and you've passed through your breakfast, you've passed through your lunch, and you've been an uh-oh, I've got no food noise and no appetite, and I've accidentally only given myself a third of the day, but I'm so not hungry that I have
Yes.
forgotten to eat, and you've only given yourself a window in which to eat something small and quick, and you're constantly only getting a third of your required vitamins, minerals, fiber, protein. Those tend to be the patients that give me feedback and they say, there's something wrong with my bowels. I'm really
Yes.
constipated, or my hair's falling out, or I'm on the floor and I have no energy and my skin is sallow. And I say, what are you eating? They say, oh, nothing.
Yeah, exactly.
So, intermittent fasting works for some people, but not for others. And it's got to do with the way that you are shaping your day and the way that you are maintaining your nutrition.
And I think that's the key point there is that, I mean, I love intermittent fasting, obviously, and it's something that's been new to me in the last 12 months. But the nutrient deficits are a really big and important factor that we need to discuss, particularly for those people who are women who are also exercising and depleting themselves in that space, because it feels great to lose the weight. But if you then find you're actually feeling terrible a few months down the track, you've lost all that beautiful muscle mass that you were trying to get, and build up in the gym, and then you're finding you're more stressed and more uncomfortable at work. That's completely the opposite of the whole reason you started. Because for me, body weight is not just what we look like, it's how we feel about ourselves and the body that we're living in. And so I think, yes, I hear you. For me, it was exactly that really quietening that food noise to allow me to fast. But then I had to find ways to work on that nutritional deficits, which did happen for me. I definitely found I lost a bit of weight in my face and in my muscles in my arms. And so I did get in the gym and we started fasting and making sure I fueled for my fasting and fueled leading into my fasting and then into the times I exercised. But how are you communicating that with your patients to make sure that they're aware that this is a game changer, but only if it's done sensibly, not if it's done with the goal of weight loss as the only result that we're counting?
It's by looking at outcomes. So it's by having a look at how they are maintaining their muscle mass during their GLP-1 journey. And it can be done in a couple of different ways. The simplest way, of course, is to simply hop on the scales and measure your kilograms lost every 3 to 4 weeks. That's as often as I recommend it. Any more
Okay.
frequent than that, and you're going to be looking at fluid losses, how constipated you are,
Yeah.
kind of over analyzing the results. So every 3 to 4 weeks is adequate. And also, of course, getting a tape measure and measuring your waist circumference. That's a really great way to be getting feedback on how your visceral fat layer is going. So I usually get patients to measure weight and waist circumference every 3 to 4 weeks. For patients who want a little bit more in-depth type measurements, they can use scales that you can get from the department store, and they just are body impedance scales that use a
Mm.
small current to estimate your muscle mass and your hydration levels. They can go to a gym and they can use a body composition scale. Some of my patients like to go to a radiology center and get a DEXA
Mm.
scan, or for
Which
those
I think is
patients,
great,
yes.
particularly for our perimenopausal women, because we are talking about, remember, the lack of estrogen and the effect on our bones and heart health. So I think a DEXA scan when you're starting a really strong nutrition plan is excellent. So
Correct.
jumping in there.
Yes. And for those patients who want something that has no radiation and just kind of estimates your weight, I also get my patients to use an app. So you might have seen on my socials, there's a free app called the Me 360 app. So some of my patients use that one where you take a photo of yourself front on, side on, and from the back, and it gets an outline of your body and it can estimate your waist circumference, your bust, your hip circumference, and give you a bubble outline of what your body is looking like. And I get my patients to take a photo every 2 to 4 months, and that way they have a series
Yeah,
of pictures.
I love
And
it.
it gives you more meaningful information than just kilograms lost. You can see the way
Yeah.
that you are holding yourself. You can see your posture. You can see how your waist is tapered in, or whether you're still maintaining your muscles in your calves, for example. So I really like visual feedback for my patients, and it's a great, simple way for patients to keep an eye. And that app is also able to estimate your water weight, your fat mass, and your muscle mass. So using these different methods, again, it doesn't matter which method that the patient uses, so long as they use a consistent method to
True.
compare each time, then we are able to have a look on the other end and analyze how have you been able to maintain your hydration? How have you been able to monitor your muscle mass during this time? And how can we do better going forward?
Oh, that's amazing. I haven't heard of that app. So I'm going to, you know what I'm going to do when I get off here. Now, I think my next question is around when you are either just doing intermittent fasting or concentrating on quite a strict nutrition plan, including perhaps using GLP-1s, what type of messaging around food types do you give your patients? You know, you and I have discussed protein powders offline before, so I'd love to hear the one that you've been working on. And I'm a big believer in 10, don't laugh, but at least 10 sources of vitamins, for example, 10 vegetables. I'm not a big fruit eater because of the spikes with a lot of like oranges and apples. I love my bananas, but I'm big into believing in raw vegetables and supplying the fiber and the nutritional content from raw veggies. What are your key aspects in that to maintain good balanced nutrition when you are fasting or when you are using GLP-1s?
Yeah. So my method is actually pretty simple, and my patients don't necessarily have to use an app to track everything or use any scales to weigh their food. I get them to just look at their plate and always aim for a palm size serving of protein. For the average person, our palm size is going to be 25 to 30 grams of protein, regardless of whether you've got fish, chicken, beef, kangaroo, lamb, any protein is going to be 25 to 30 grams. If you got two boiled eggs, that's 14 grams of protein. If you got a can of tuna, that's 19 grams of protein. So any meal, try to aim for about a palm-sized serving of protein on your plate and no more than a fist-sized serving of carbohydrates. Aim for complex carbohydrates, things like black rice, brown rice, red rice, whole grain bread, but no more than a fist-sized serving. However, for my patients who are insulin resistant, and that's an insulin resistant umbrella where you have been diagnosed as officially insulin resistant, or you're pre-diabetic, or you have polycystic ovarian syndrome, or you might be going through perimenopause, for example, have a little bit less. So some of my patients, I get them to have 2/3 or a half
Mm.
of a fist size of complex carbohydrates just to reduce that carbohydrate portion. Then half of the plate is your rainbow salad or vegetables. And I say rainbow because the more variety that you have, the more colors that you have, we know that you're going to be getting lots of different vitamins and minerals that way. And then a
Definitely.
thumb-sized serving of your healthy fats, whether that's going to be avocado, whether it's going to be extra virgin olive oil, whether it's going to be nuts that you're sprinkling over your salads. So my patients don't log anything. They don't need to use an app. They don't use any scales. They're just looking at their plate and looking at their hands, and we just keep it nice and simple.
Yes. Well, I mean, life is busy enough as it is, isn't it? Just
It
keep it
is.
simple. And I mean, that's fantastic. So I guess the last part I'd love to hear is what are you doing in your business space? Because I know there's going to be people that are going to listen to some of the stuff you and I are talking about and say, I want to meet with Dr. Angela and get her to help with me. And obviously I'm going to be sharing things on social media with you and myself over the next couple of weeks. But I know you work in this space every day, and there are rural and remote women who I'm very passionate about that would love to have access. And a lot of you have actually contacted me online already and said, how do I access someone with this experience? My GP doesn't quite have the knowledge, and I live in a small town and don't have access. So can you just share a little bit to close about your current business and how women can access you if they'd like to get your help?
Yeah, so I originally was working in a regular general practice, but I wanted to help people all over Australia. And that's the reason why I created the Enlighten Me medically supervised weight loss program. It is a telehealth based program so that we look after patients even in the most rural and remote parts of Australia. We do it as part of a multidisciplinary team. So it's not like one of those services where you just get a script for weight loss medication. So, for any of you who are looking for that kind of doctor, I'm not that kind of doctor. We do very thorough care. We look into the factors contributing to your weight. And at the same time, we're more than happy to kickstart you on your weight loss journey because really, the sooner that patients lose their first 5 to 10%, everything kind of falls into place. It's so much easier for you to exercise. It's so much easier for you to start maintaining sustainability when it comes to your nutrition. So everything just kind of gets easier for them to maintain it themselves. And I work alongside another GP with a specific interest in weight management, an exercise physiologist, and a nutritionist. And that program is called the Enlighten Me Medically Supervised Weight Loss Program. And you can learn a bit more about that on my website, which is enlightenme.com.au. On the website, you'll be able to learn a bit more, and there will be a webinar there where you can watch some case studies and see how the patients are treated and see if that's something that you might be interested in. If you are interested, you can book a call with me and I can have a chat with you about your case and see if you're a good candidate and see if you might be interested in the program. So that's what I started to be able to help more patients outside of my local part of Sydney. And it was about a year in from doing that that I noticed that a lot of patients were struggling to get in enough protein. They were struggling to get in enough nutrition. And that's because a lot of them were taking the GLP-1s. They weren't able to meet their protein and nutrient requirements. Some of them were struggling with the side effects like bloating, nausea, and reflux, and they weren't necessarily able to get enough protein from whole food sources. With that delayed gastric emptying that we were just talking about, where the stomach's moving in slow motion, for some patients, it does get hard to digest their meat and digest their eggs, and they do get something that we call sulfur burps. If you've ever had it, you'll know exactly what I'm talking about. And we tried to get them to have supplementary sources of protein. So we tried meal replacement shakes, we tried a few bars, we tried a couple of soups. But what we found was that a lot of the commercially available ones had fillers like maltodextrin, like polydextrose. And what this actually does is it actually increases your insulin levels and it increases your glucose levels. So it's not really aligned with your goals of what the GLP-1 is trying to achieve. And a lot of these also had artificial sweeteners, which gives you bloating, gas, diarrhea, and loose motions. And that also doesn't help with the side effect profile of the GLP-1s. So with that in mind, I actually formulated the Enlighten Me shakes. And those are a Australian made formulated meal replacement shake that has your palm sized serving of protein.
Perfect.
So 32 grams of protein, only 5.5 grams of carbohydrates, like a thumb-sized serving. So I deliberately made it very small to help those patients with insulin resistance. And it also is very gut friendly. So it's certified FODMAP friendly. It's got prebiotics, probiotics, daily greens. It's easy to digest with the digestive enzymes as well. So that's
You'll
what I
have to send me some.
Yes, I do have to send you some. That's what I've been doing a bit behind the
That's
scenes.
awesome.
Thank you.
Well, thank you very much, Dr. Angela Kwong, for sharing all your knowledge with us. We will have comments, obviously, where people are going to ask more questions. So I think the goal will be, for now, let's try and meet again in a couple of weeks. And if people want to ask any questions, I think this is the time to have someone as incredibly enlightened as yourself in this knowledge space, because there is so much taboo and stigma and so much misinformation. It's really hard to find good quality. Even as a doctor myself, it's hard to find good quality research and facts, so much conflict. So I think it's just sometimes nice to sit down, have a conversation about this. Let's find out what people want to know about, and try and answer as many things as we can.
Thank you so much, Jana.